everyone, we are the Group 9 and we are going to be presenting the laboratory workup for the non-protein nitrogen-related diseases. So, NPN, also known as the non-protein nitrogen, was discovered during the early times of clinical chemistry, wherein it is analytical methodology involves the removal of protein in a sample prior to testing. It can be measured quantitatively using spectrophotometer through converting nitrogen to ammonia with the reaction of a nitrous reagent that yields into a yellow color. So, it is also considered as a complex technique to perform. It can produce an accurate results for a total non-protein nitrogen concentration. So the most abundant non-protein nitrogen compounds are urea, uric acid, amino acids, creatine, creatinine, and ammonia. So most of these substances are produced during the catabolism of nucleic acids and protein. Urea is the primary excretory byproduct of protein metabolism. It is also known as carbamide, wherein it is the main organic component of human urine and the waste product of many living things. It is created in the liver from the free ammonia and amino groups produced during the protein degradation. So the concentration of the urea in blood depends upon the relationship between the urea production and the urea excretion. Clinical significance of urea. So measurements of urea are used to evaluate renal function, hydration, nitrogen balance, assist in the diagnosis of renal illness, and the assess of the effectiveness of dialysis. So a protein-free filtrate of whole blood was used initial in the measurements of urea, which are based on the counting the quantity of the nitrogen. So an increased BUN level might be an indication of or might be a sign of a renal illness, shock, dehydration, diabetes, and an abrupt myocardial infarction, and on the other hand, decreased BUN level might be a sign of an overhydration, poor absorption, and decreased liver failure. So methods of measurements. First, we have the glutamate dehydrogenase or the GLDH enzymatic method, wherein it's the most used technique, which includes the glutamate dehydrogenase and the urease reaction, and it measures that the rate at which nicotine amide adenine dinucleotide disappears at 340 nm. It has a high accuracy and precision, wherein the enzyme glutamate dehydrogenase facilitates the process. Second, we have the conductivity method, which is also an enzymatic method, wherein it measures the ability of an analyte or medium to conduct an electrical current between electrodes or reference nodes. So other techniques that involves in these methods of measurements, we have the isotope dilution mass spectrophotometry, wherein it is widely used reference method and is recognized for being extremely precise when it's used in quantitative testing with isotopical labeled compound. Reference intervals. First, for the plasma or serum, so the adult male or female should have the 10 to 20 mgtl. For the child or infant, we should have the range for about 5 to 18 mgtl. For the newborns, should be 3 to 12 mgtl. And for the urine over 24 hours, the adult should have 12 to 20 G over D or 0.45 to 0.71 mole urea per D. So for the conversion factor, it should be 0.357 mole per D.
For this slide, we have uric acid. When purine nucleic acids are broken down, uric acid is produced. Uric acid is absorbed by the body and utilized in the proximal tubules despite being filtered by the glomerulus and excreted by the distal tubules into the urine. Painful inflammation may arise when uric acid accumulates in the joints and other tissues due to its insoluble property in plasma. For the next one, we have clinical applications and significance. Uric acid is tested to confirm the diagnosis of gout and to monitor the therapy of the condition, to avoid uric acid nephropathy following chemotherapeutic treatment, to evaluate genetic diseases of urine metabolism, to associate kidney diseases, and to aid in the detection of renal calculi. For the methods of measurement, it has two types naman, chemical methods tsaka enzymatic. For chemical method, we have Caraway method. Caraway method is derived from oxidized uric acid in a protein-free filtrate facilitated by a tungsten blue in alkaline solution, which is a product of reduced phosphotungstic acid. For enzymatic method naman, we have uricase method. Uricase is an enzyme responsible for converting uric acid to allantoin via oxidation reaction. This technique measures the difference between how much uric acid and allantoin are absorbed at a wavelength of 293 nanometer. Absorbance changes before and after uricase incubation are directly proportional to uric acid concentration. Next one, we have coupled enzymatic method. So when uric acid is converted into allantoin, hydrogen peroxide is formed, which may be measured using a coupled enzymatic method. The enzyme peroxidase acts as a catalyst in a chemical indicator reaction. The intensity of the color development is directly proportional to the concentration of uric acid present in the sample. And other techniques are also involved, which is isotope dilution mass spectrometry. It detects the specific fragments that are produced by ionization, and quantification is conducted with the aid of an isotopically labeled compound. So for this slide, we have the reference ranges, and it is different from plasma or serum at saka sa urine. For male, we have 3.5 to 7.2. For female, we have 2.6 to 6.0 milligrams per deciliter. And for children naman, we have 2.0 to 5.5. And for urine, adults have 250 to 750 milligrams per deciliter. And for the conversion factor, we have 0.0595 millimole per liter.
So the creatinine is primarily synthesized in the liver, since it is the organ responsible for maintaining the normal range of creatinine. And it is the product formed in the muscle where the conversion of creatinine to creatine phosphate occurs. Hence, it is a high energy source. And the loss of phosphoric acid in creatine phosphate and the loss of water in creatinine can yield creatinine, while the creatinine concentration in blood plasma is proportional to an individual's muscle mass. And the removal of creatinine in the circulation is excreted in the urine via glomerular filtration. The clinical significance of creatinine involves the kidney, and I said earlier that it is the one responsible for maintaining the normal range of creatinine. Abnormal levels of creatinine in blood and urine is an indicator of kidney disease, and to be specific, an elevated creatinine level indicates the following, such as chronic kidney disease, kidney obstruction, kidney infection, diabetes, increased protein intake, or intense exercise. On the other hand, low creatinine level indicates the following, such as low muscle mass, extreme weight loss, or malnutrition, and even the creatinine levels during the pregnancy is low because of the excessive rate of glomerular filtration and excretion in the urine. These are the following methods of measurement for creatinine. So starting from chemical methods, we have Joff reaction, Joff kinetic, and the Joff with absorbent and Joff without absorbent. So the Joff reaction, this is where the creatinine reacts to alkaline picrate to form a chromogen or a red-orange complex. However, it is proven to be non-specific and susceptible to interferences. The Joff kinetic naman is preferred over Joff reaction since it is the improved version of Joff reaction. The development of color is tied to avoid interferences from non-creatinine chromogen. However, positive bias can be observed here because of the presence of alpha-keto acids and cephalosphorines. The absorbent used here promotes the specificity of this method. Lastly, in chemical methods, we have Joff without absorbent. A creatinine in protein free filtrate will react to alkaline picrate to form colored complex. It is also similar to the Joff reaction since it is also positive bias due to the following interferences such as vitamin C, glucose, glutathione, alpha-keto acids, uric acid, cephalosphorines. Aside from chemical method, we also have enzymatic method, which is the isotope dilution mass spectrometry, which is a quantitative method that follows ionization using isotopically labeled compounds. And it can detect characteristics or distinctive fragments. Last but not the least, we have the reference range and conversion factor. So these are the basis for the measurement of creatinine.
Ammonia. Ammonia is a product of amino acid deamination during protein metabolism. It is eliminated from the bloodstream to be converted to urea in the liver. Free ammonia is considered toxic but can be found in low concentrations in plasma. Ammonia may exist in two forms, the ionized and the unionized form. Ammonia takes the ionized form in lower pH, whereas a higher pH causes the ammonia to be in its unionized form. The concentration of ammonia in blood provides an important information in certain clinical conditions, such as Reye's syndrome, hepatic failure, and hereditary deficiencies involving urea cycle enzymes. Reye's syndrome is an acute metabolic disorder in the liver which commonly occurs in children. The most frequent cause of an abnormal ammonia metabolism is severe liver disease. The methods of measurement of ammonia. First one is ion selective electrode or ISE. It is a rapid, accurate, and precise quantitative screening method of measuring ammonia. The next is the glutamate dehydrogenase. It is an enzymatic method. It is considered as the most commonly used method with automated instruments due to its high accuracy and precision. In this method, the ammonia reacts with 2-oxaloglutarate and NADPH to produce glutamate water and NADP, or the reduced form of NADPH. The reaction is catalyzed by the enzyme glutamate dehydrogenase. Reference intervals. For healthy adults, the normal ammonia level should be 19 to 60 milligrams per deciliter. For children, it must be 68 to 136 milligrams per deciliter. Conversion factor is 0.585. Lastly, we have the amino acids. Amino acids are the building blocks of proteins. They are being filtered by the glomerular membranes but are typically reabsorbed in the renal tubules by a saturable transport mechanism. An increased level of particular amino acid may show that there is a problem with the body's ability to break down or metabolize a particular amino acid. It is a useful marker in detecting amino acid metabolic disorders in newborns. For the methods of measurement, first we have the thin layer chromatography. It is a qualitative test. The mixture components are separated between a fixed stationary phase and a liquid mobile phase by differential affinities between the two phases. We can also use one-dimensional thin layer chromatography or two-dimensional thin layer chromatography. Second, the capillary electrophoresis is a quantitative test. It is performed with the use of a small bore measuring about 10 to 100 micrometers in diameter and with a few silica tubes that are about 20 to 200 centimeters long. It can measure amino acid concentrations in femtomolar units. Other techniques include gas chromatography, ion exchange liquid chromatography, and tandem mass spectrometry. Gas chromatography is widely used to determine the amount of amino acids in biological samples. It is considered as a rapid method that requires only a small amount of sample. Second one is ion exchange liquid chromatography, which is useful in the separation of a variety of amino acids in order to qualify them. Lastly, we have the tandem mass spectrometry. It can be used as a screening method to detect amino acid metabolic disorders in neonates. For the reference interval, for healthy adults, it must be 4 to 8 milligrams per deciliter. For children, it must be 68 to 136 milligrams per deciliter.
These are the references used in this topic. Thank you so much for watching.